Welcome to the Biopharma Business Intelligence Unit, where symbolic integrity meets strategic clarity. At BBIU, we go beyond the headlines to decode the structural forces behind global biopharma, AI, and economic realignment. If you value precision, verification, and symbolic depth, this channel is for you. Subscribe now to access our weekly briefings, dossiers, and intelligence reports, and consider joining our institutional tier to unlock early warning systems, custom metrics, and exclusive strategic insight. You're not just listening, you're entering the future of epistemic intelligence. www.biopharmabusinessintelligenceunit.com.
Restoration of central vision with the PRIMA system. NOV First Executive Summary. The PRIMAvera trial, NCT 46676854, represents the most advanced clinical evaluation to date of the PRIMA bionic vision system, a subretinal photovoltaic implant designed to restore central vision in patients with advanced geographic atrophy due to dry AMD. Sponsored by Science Corporation, formerly Pixium Vision, the trial recruited 38 patients across multiple European sites. Results at 12 months, published in NEJM 2025, demonstrate that 81% of participants achieved clinically meaningful improvements in visual acuity toward 10 letters gained, with real-world functional outcomes such as word and number recognition. Safety outcomes suggest tolerable risk, mainly surgical, with no systemic device-related adverse events. The study is active, not recruiting, with long-term follow-up extending to 2028. This trial marks a paradigm shift, from slowing progression of AMD to restoring lost central vision. Yet, risks remain in scalability, durability, cost-effectiveness, and equitable access. Structured BBIU opinion clinical layer. The PRIMAvera trial delivers tangible visual restoration, not just preservation, in a patient group with previously irreversible central blindness. Functionally, patients regain the ability to read numbers and words, a milestone in retinal prosthetics. However, improvement is partial and dependent on external glasses, not restoration of natural sight. BBIU comment. A structural weakness is the 30 patrician at 12 months. 638 patients not evaluable, including 3 deaths. The reported efficacy figure of 81% responders reflects only the 32 assessed patients, not the total implanted cohort. On an intention-to-treat basis, the effective success rate is closer to 65 to 70%, which materially alters the interpretation of the primary endpoint. This gap between evaluable and enrolled undermines the strength of the efficacy claim and will weigh heavily in regulatory review. Economic layer. The market potential is vast, millions of AMD patients worldwide, but cost barriers loom. Device implantation requires high-tech centers, surgical expertise, and rehabilitation. Without reimbursement pathways, adoption will remain restricted. Early approval in Europe could drive niche uptake, but systemic expansion demands strong cost-effectiveness data. Symbolic layer. This trial symbolizes a turning point in ophthalmology, shifting from managing decline to engineering restoration. Symbolically, it positions Science Corporation as an inheritor of Pixium's vision science legacy, embedding AI optics neuroengineering convergence into clinical practice. The implant becomes both a biomedical device and a symbolic interface of human technology fusion. Systemic risks, durability unknown, device longevity and chronic retinal response still untested beyond 12 to 24 months. Equity risks, likely to benefit elite healthcare systems first, global access doubtful. Regulatory friction. FDA approval will demand longer-term data, EMA may move faster. Expectation gap. Patients may expect near-normal vision, but functional gains remain limited. You've reached the end of the open section of this BBIU content. The complete analysis, with full data, structural frameworks, and extended annexes, is available exclusively to our subscribers. At BBIU, we believe the real value lies beyond headlines, in the depth of structural intelligence that helps leaders and organizations see further. If you want access to the complete archive and future reports, join us at BBIU and take part in the next level of analysis.